This all comes as childhood vaccination rates are declining, and experts say that drop could lead to dangerous consequences.
Yeah, 10 TV's Libby Cathy is here now to explain how fewer shots could lead to more outbreaks. Libby?
That's right, Jeff and Yolanda. Data from the Department of Health shows more Ohio parents are choosing to delay or skip routine childhood vaccines. But doctors warn that decision doesn't just put individual kids at risk, it threatens the health of entire communities.
In Ohio, the declining childhood vaccination rate is alarming health officials. Last year, 85% of kindergartners met all vaccine requirements, down nearly 4.5 points from 2019, and below the 90% mark needed for herd immunity, which happens when enough people are vaccinated to slow the spread of disease.
There are 10 vaccine preventable diseases that, children are required to get before they enter into school, but there are exemptions.
And with exemption rates rising, so are public health concerns.
That's the danger. Unfortunately, kids are going to die because of this, and people are going to die just like they did before we had vaccines.
Take measles, for example. The U.S. has already recorded more than 1,400 cases in 2025, the highest number in 25 years. 35 of those were in Ohio, and almost all involved those unvaccinated.
These diseases aren't just something of the past, and they used to be. It concerns me that we'd be looking at a world again where we'd worry about polio.
Public health experts blame much of the vaccine hesitancy on misinformation.
The problem is that all of the misinformation just completely disregards and ignores decades of science and outcomes. And I'm scared to think about what is bottom going to look like and how much disease and how many people have to die before people realize that this isn't the right course.
Republican Senator Bernie Moreno told 10 TV it's important to follow the science.
But ultimately, we live in a country where you should have freedom of choice and freedom of responsibility, and that should be medical freedom as well. And I think that's something that we should all agree on as Americans, as long as you're not affecting somebody else.
Ohio health experts say that personal choice can have public consequences.
Herd immunity is very important, and we need others to be vaccinated around us to keep us all safe. It's really a community prevention strategy, and we all have to look out for each other.
The president of Ohio Advocates for Medical Freedom said in a statement to us tonight, science should always be up for debate, but our personal liberties and parental rights shouldn't be. That group is advocating for legislation to protect adults from vaccine status discrimination. They also want schools to be required to inform parents they have a right here in Ohio to vaccine exemptions. Libby Cathy, 10 TV News.